So now we're going to be talking about the opening in the median. So when we talk about the median, we're talking about three main structures. So the esophagus, the trachea, and the thymus. So we're talking about this area over here. We'll talk about the blood vessels after this. Although there are other structures that do pass through the midline, but we're not really concerned with them right now. We're going to be discussing them in a bit. First, we're going to be talking about these three: the esophagus, the trachea, and the thymus. So here we have a slide where we can see all of these structures. We can see the trachea, we can see the esophagus, and we can see the aorta, other blood vessels, and some nervous structures. But here we are primarily concerned with the esophagus. So this here. So the esophagus is a muscular food passage lying between the trachea and the vertebral column. It is a downward continuation of the pharynx in the midline. So here we'd probably have the pharynx continuing downwards in the midline. Begins at the lower border of the cricoid cartilage. So we can't see this exactly in this image, but here you can see that this is the trachea. This is the trachea. And if we go further up, you would see something here called the cricoid cartilage, right over here. And where it begins, it is also opposite the C6 vertebra. So let's write this one down. Okay, and it passes downwards behind the trachea and enters the thoracic cavity via the superior thoracic aperture into the mediastinum. So let's look at the thoracic aperture. Is right over here. See, this is our first rib. So where is it entering? It's entering right here. Or let's use a different color marker. So this is our superior aperture. As you can see, this is the level at which the esophagus is entering into the mediastinum. So we'll discuss the esophagus when we talk about all of the organs in the mediastinum in a future lecture concerned with the mediastinum and the structures of the mediastinum. But right now we're just talking about all of the structures that are passing through the superior thoracic aperture. The next thing that we're going to be looking at is the trachea. So here we can see the trachea. It is the non-collapsible part of the airway forming the beginning of the lower part of the respiratory tract. It is kept patent by the C-shaped hyaline cartilage rings on its anterior aspect, while the rest of the tube is made by muscle. What that means is our trachea is made something like this, where the anterior part is made of hyaline cartilage and the posterior part is made of muscle. It runs most of its course in the midline, just like the esophagus, and it also enters the thoracic cavity through the superior aperture of the thorax. Now, there are many relations of the trachea. So let's switch over to this image now so we can see these relations a little bit better. Here we have the trachea. You can see right over here, peeking from behind. But what we're concerned with is all of those structures that the trachea is related to anteriorly, because we already know that posteriorly it's related to the esophagus and the esophageal plexus, as we saw in the previous image. And now we're talking about those structures that are in front of it. So starting from the trachea all the way coming forwards towards the manubrium sterni, first we have the left and right brachiocephalic veins. And from them, we have the inferior thyroid vein. Primarily what crosses over towards the left side is the left brachiocephalic vein, right in front of the trachea. And from there we have the inferior thyroid vein that climbs up the trachea to reach the thyroid gland. Okay, so next we have the aortic arch that we saw in the previous image, which comes right over here. The aortic arch divides into the brachiocephalic trunk and the left common carotid arteries. There's a third branch called the subclavian artery, which is separate, but it's past the trachea. So there are three main arteries that come out from the aortic arch: the brachiocephalic trunk, the left common carotid artery, and the subclavian artery, the right subclavian artery. So let's label them now. I'm just coloring this for your understanding. And the right subclavian artery is past the trachea. So what we're concerned with right now are the right brachiocephalic artery and the left common carotid artery. And after that, we have the deep cardiac plexus. So you can't really see that one over here, but we'll see it later in later images. There's big nerve plexuses surrounding this. So we'll see it in a later image. This is the deep cardiac plexus. Well, what you see over here is the superficial cardiac plexus. So I'll just write cardiac plexus. But what's related to the trachea is the deep cardiac plexus. And we also have some lymph nodes. And coming more anteriorly, that's where we see our thymus gland. So we're going to color this now. And it's going to be the most anterior structure. And finally, we have the sternothyroid muscles and the manubrium sterni, which you cannot see in this image. So I'll erase these structures now so that you could see the image more clearly. There we go. How's that? Okay, so now we're going to be talking about the thymus gland. So let's erase this. Here we have the thymus gland. The thymus gland is primarily a lymphoid organ. It is located in the inferior part of the neck and the anterior part of the superior mediastinum. It is flask-shaped and flat, lying just posterior to the manubrium. And after puberty, the thymus gland gradually involutes and is replaced with fat. So when we see our superior aperture, this is the boundary. And you can see that the tips of the thymus gland, they are part of those structures that are in the plane of the superior aperture.